So what if I told you that we could have drastically reduced the incidence of 13 different types of cancer, heart disease, reverse the majority of type 2 diabetes, and even improve people's mental health just by treating one root cause disease? Would that seem too good to be true? Well, it can happen, and it's happening now. How? By treating obesity. 75% of our country is having a weight problem, and it's impacting their health, and it's impacting our health care system, which is really a sick care system. Systemic inflammation as part of excess weight begins much, much sooner than the 30 to 60 pounds a person needs to gain to develop obesity. Obesity fueled the COVID-19 pandemic. Death rates are 10 times higher in countries where more than 50% of the population has a weight issue. This is because of systemic inflammation. 100 million US adults are trying very, very hard and spending over $300 billion trying to lose weight unsuccessfully. And this leads to a cycle of failure, frustration, self-blame, and guilt. And it just doesn't make sense. How can 75% of the country be trying so hard and failing so badly at losing weight? What if obesity isn't just a lifestyle problem? So my journey began when I was a medical resident. I was caring for people in the hospital day in and day out, a lot of them with complications from type 2 diabetes and cardiovascular disease, some of them in their 40s and 50s. And I kept wondering, how did they get here? How could we have prevented this? And I wasn't getting any answers because, again, it's sick care. We're just turning people around, teeing them up, sending them out, and hoping for the best. So fast forward my completion of residency and the opportunity my outpatient mentor gave me to join Kaiser's medical weight management program. So I didn't really know anything about that or about treating weight because we didn't learn about it in residency or medical school. But it was a part-time opportunity, and I had had 2 kids in med school and 2 in residency, and that seemed like a pretty good idea. And so I started treating these patients, and they would lose 40 pounds, 60 pounds, 100 pounds. And like magic, their chronic conditions improved. They came off their meds. They got their lives back. Health, freedom, more time. And I thought, wow, this is like the labor and delivery of adult medicine. I'm in the right spot. But then, a lot of them started regaining their weight. And all these conditions came back. And it felt, again, like we were rearranging the chairs on the Titanic, just like when I was in inpatient medicine. And so I got a research grant from Kaiser to evaluate the program and see were we really making a difference. And it turned out that our study showed that 4 to 5 years out, we were achieving sustainable weight loss of 4 to 5%. That 10 to 15% that we needed that was reversing all these conditions only lasted for about a year. So I decided to learn a little bit more about this, and I got boarded in obesity medicine, lifestyle medicine, and I even trained as a culinary chef, a culinary medical chef. And my conclusion? was that obesity is a chronic, relapsing, treatable neuroendocrine disease. It causes or worsens dozens of medical conditions. Appetite and weight regulation are strictly controlled by the brain. That's the science. That's what the data shows. There's central systems and mechanisms at work, and also peripherally in the pancreas, in the gut, in the adipose tissue. So that got me thinking. I wish we lived in a world where I could get more data and show that if we treated obesity, that we could have the outcomes. We could reverse type 2 diabetes and all those other conditions so that people would listen, and then we could make this happen. And then I had a realization, this data exists. Bariatric surgery. Bariatric surgery improves health. It improves cardiovascular disease by 40 to 60%, 8 years out. And that's major adverse cardiovascular events, death, and everything in between. And speaking of that, weight loss post-bariatric surgery cuts death rate in half for those 13 different cancers that I mentioned. Bariatric surgery reverses type 2 diabetes, or at least puts it in remission, for 75% of people, even 5 years out. It lengthens life by 6.1 years. Bariatric surgery is actually a metabolic surgery. When you tinker with the gut and you change it around, you also affect all the hormones that signal the brain about appetite and weight regulation. We need about 10, 15% weight loss to reverse a lot of the conditions that I just mentioned, and also sleep apnea, fatty liver, blood pressure, and improve physical function. So what if we could get surgical results without the surgery? It turns out that these days, it seems like we can. The obesity drug market is set to double in the next 4 years. The market today is vastly expanding. 2023 to 2026, a bunch of phase 2 to 3 trials, and so much more in development around hormones and all those different transmitters that I mentioned work in the brain and in the rest of the body. And so more diverse and targeted medications are going to give us the opportunity for precision delivery and applications. Semaglutide, which is the new darling of this space, also known as Wegovy, works in 92% of patients. And 1/3 of them are able to achieve surgical level weight loss. Tirzepatide, also known as Mounjaro, not yet FDA approved for weight loss, but approved last summer for the treatment of type 2 diabetes, does the same thing, but instead of one hormone, now we've got 2 hormones in this medication, so it's even a little better. We also have the outcome studies, just like in bariatric surgery, that show that these GLP-1s, that's the name of this class of medication, improves MACE, major adverse cardiovascular events, type 2 diabetes, and has mortality benefits, just like bariatric surgery. But we also know that single interventions cannot achieve weight loss. We know this because of all the other chronic conditions that we treat. Medications are part of the puzzle, but alone, they're not enough. There are issues with medication compliance, and we also know that you need lifestyle intervention to actually improve the biomarkers, body composition, and much more to create that health and that longevity. So we need the right tech-empowered ecosystem to create healthcare that is continuous, virtual, personalized, tech-empowered, and value-based. And that's Enara. Anara is a digital health clinic focused on tackling obesity. We're turning a fragmented ecosystem into a one-stop personal experience for a patient using their home medical clinic as a touch point. We've identified 9 key factors that are central to treating obesity. 4 of them are listed here: the nutrition, physical activity, behavior, and medical management. And so the Enara difference is that we have a responsive design, and it optimizes the timed interventions and which interventions we should choose and when. And then these different comorbidities improve. So the program is virtual. It involves synchronous care, asynchronous care, and a data-driven approach, producing better than clinical study results, insurance covered. A paper we published in 2019 showed sustained weight loss of 14.2% at 18 months. And what's interesting to note, that was back in 2019, 45% of those patients were not even on anti-obesity medications. Fast forward to Enara 2022, and the 36 weeks outcome studies that we have show 17% sustained weight loss compared to the same time point of 36 weeks for the Wegovy Step 1 trials of 13.6%. An IRB-approved study that's going to be coming out that we're working on in the next couple months is going to show sustained weight loss at 36 months, and also at 48 months once we get more data there. And that's starting to eclipse sleeve gastrectomy results. Obesity medicine is going to be at the center of a diagnostic, pharmacologic, and behavioral shift in how we understand, segment, and treat chronic disease, because it's the majority of the country. A revolution in medical care is coming with obesity medicine and AI-empowered tech at the epicenter. And we're inviting the world to join us in treating the roots, not the fruits of obesity, with obesity care everywhere. And that's life-changing weight loss. Thank you.